Welcome to the channel Future Ready Doctors.
I don't want my clinic to have a provider tag in front of my practice. I'm not a provider.
Some orthodontists these days are giving aligners like toffees to chew.
Now what happens over here? Profitabilities of the company, who is at loss? Insecurity in dentists is very high. We should not be scared of our own fraternity.
Even in the medicine and dentistry and orthodontics, what kind of a leadership do we require? So the trident of medical leadership, if I may say so, is that one blade of the trident is clinical leadership. The other blade of the trident is the academic leadership. The third blade, which is often not given credence. Yes, I'm talking about the entrepreneurial leadership. The leadership wherein the doctors take the charge from within the community, come up and take the baton of change.
The biggest problem is in entire medical sciences mistrust.
AI is very promising for the healthcare per se. Our diagnosis and treatment planning can be faster. AI can act as a research assistant. It can help us into having better differential diagnosis. And then one thing we need to incorporate in our medical education system is entrepreneurial leadership, that how to get the funding.
Now I will differentiate between taking a loan and taking a funding.
Coming back to leadership, what kind of a leader you feel you are?
The person sitting on top of the pyramid and the base of the pyramid should be treated equally. What do you think as leadership?
It's not, tables are turning.
Yeah.
So you are consciousness leadership. Dhruva, I tell you, there have been certain events in my life recently. I realized that we need to be a part of a community. We need to grow as a medical fraternity together. We are. But are we there in our tough times? Are we there when we are not at the peak of our careers, but in the valleys? And see, as a doctor, you also know that we are juggling many balls. Health, wealth, business, relationship, patient management, team management. It's not possible to be at the peak in all the phases all the time. We have our own shallows. Exactly. Do we have a set of 5 friends, 10 friends who are there for us? Are there, suppose we have Indian Medical Association, we have Indian Dental Association. Are there any healing programs going on? Are there any psychological therapies available? Do we have coaches who are acting on our quote-unquote frequency, vibration, health, mental health, sound healing? Recently, I realized that when the medicine started, they used to call डॉक्टर साहब के हाथ में शिफा है, छूते हैं ठीक हो जाते हैं. Many doctors must relate with this, that डॉक्टर साहब आपकी स्माइल देख के ठीक हो जाते हैं. 80% तो आप पर्चा लिखते हैं, वो तो अलग चीज़ है, वो तो 20% है. 80% तो आपके चेंबर में देख के खुश हो जाते हैं. अब वो जो शिफा था, वो जो हीलिंग फोर्स हमारे थ्रू जाके पेशेंट को हील कर रहा था, अब अगर डॉक्टर ही डिप्रेशन में है, डॉक्टर ही, एंड सी वी आर ह्यूमन बीइंग्स, राइट? पीपल माइट बी हैविंग हेल्थ इश्यूज, रिलेशनशिप इश्यूज, सर्टेन इश्यूज. सपोज पर्सन डॉक्टर ए, डॉक्टर बी. डॉक्टर ए कार्डियोलॉजिस्ट हैं दोनों, सपोज मिस्टर शर्मा एंड मिस्टर वर्मा. डॉक्टर शर्मा जो हैं वो डिप्रेशन में हैं, तो हौले हौले आ रहे हैं, ये वो ठीक है, मैं डॉक्टर हूँ तो उनकी अनकॉन्शियस कॉम्पिटेंस है कि वो आके ट्रीट कर सकते हैं. वर्सेस डॉक्टर बी, डॉक्टर वर्मा, वो जॉली हैं, परेशानियाँ लाइफ में सबके होती हैं, बट मेडिटेशन किया अपना थोड़ा, रीडिंग सम मोटिवेशनल लिटरेचर, इज हैविंग अ गुड सेट ऑफ फ्रेंड्स. एंड देन व्हेन दिस हैपेंस, who is the doctor you would like to go to as a patient?
As a dentist, when we want to understand that we want to grow big. Now, entrepreneurship in dentistry is entered, and people want not to be just called as a local dentist. A term hota hai pass wala dentist. People want to be big, and when I understood that I want to do something bigger than dentistry or bigger in dentistry, I made sure one thing which I want to do is I want to make a team. I cannot do everything. You were mentioning about some dragonfly effect. What was that?
There's a lily in a pond. A lily. They have many small crawling insects below. Went up, started crawling, and now there's this interesting phenomena that when the sunlight hits this insect, the wings expand and it turns into a dragonfly. And the dragonfly, earlier it was in just 2 dimensions. Now it has a whole set of dimensions opening up. It can see the sky, it can see right, left, up, down. It can fly. The basic point of the story is that growth requires courage. Firstly, everybody wants to become a dragonfly, but do we have the courage to go into the domains of entrepreneurial leadership, to take the risk, go up? Secondly, do we have that intention to serve? to come, try to help people by creating systems, processes, companies, learning management systems, platforms. And thirdly, most important, a guilt-free existence. Not feeling bad within yourself. What is your personal philosophy with regards to use of business when we talk about medical practices, dental practices, how to run the clinics like a corporate? What kind of a leadership do we require? What do you feel has changed over time?
Let's begin.